Welcome back to Living Local. Today is National Women and Girls HIV AIDS Awareness Day. March 10th is observed annually as a time to increase awareness, spark conversations, and highlight the work being done to reduce HIV among women and girls in the U.S., while also showing support for those living with this disease. Joining us via Zoom today is Lauren Gill. She's the Director of Supportive Services with the Project of the Quad Cities. Lauren, thank you so much for joining us.
Thanks for having us, Brittany.
So we have touched on this before, but can you tell us exactly what HIV AIDS is?
Yes. So HIV and AIDS are very common acronyms thrown around, but still need reminders for what they indicate and what the diseases themselves are. So HIV stands for the human immunodeficiency virus. And the virus itself does what it sounds like. It makes our immune systems deficient. AIDS stands for acquired immunodeficiency acquired immune deficiency syndrome, which is a result of someone having a high concentration of the HIV virus in the body. And AIDS is something we usually see less than we did in the 80s and 90s, and it's a result of people taking too long to be diagnosed or being unaware of their status. So like I was mentioning, the way these viruses impact the body is in relation to our white blood cells that help us stay healthy and fight infection. So when a person has HIV, the white blood cells in their body that fight infection decrease in number, which means that something like a common cold, which might affect the average person and make them ill for a day or two, could significantly impact the immune system of someone with HIV if they have a high level of the disease in their body. So people can just get really sick from things we call opportunistic infections. And it's something that's still, there are new infections and new diagnoses in the world today, and we're doing our best to eliminate HIV and eliminate AIDS and new infection globally at this time.
And Lauren, can you talk a little bit about how HIV and AIDS uniquely impacts women here in the United States?
Yeah, so a lot of people don't consider the impact on women and girls. But at this point in time, about 1 in 4 of people living with HIV and AIDS are women and are girls. At the beginning of this disease epidemic, men were disproportionately affected, and I think as a result, women became unaware that they could also be affected by it. So we're seeing, luckily, a decrease in new infections among women and girls, but a lot of women and girls don't realize that they are part of the risk population. So regardless of age, regardless of race, gender, all those things can be effective for someone to be a contender for getting HIV.
Now, there's not a lot of conversation around how HIV and AIDS impacts women and girls. Why is that?
Yeah, so it's kind of a three-parter. Stigma is one big part. A lot of people are afraid to know what they don't know. So many people, especially women who may only have heterosexual relationships, don't end up going to get tested throughout a lifetime because of fear of confirmation of the test or assuming that they couldn't be affected because the stigma around the disease is that it's primarily affecting men and men who have sex with men. So that's part of it, stigma. And wrapped up in stigma and in community connection is fear. If I do have HIV, what does that mean? So many people still have the same story in their minds about HIV and AIDS that were originated in the 80s when this epidemic started. That if they get a diagnosis that they are HIV positive, that it could mean that, death is imminent or they can't thrive and live a good life, which we know not to be true now that we have medications that properly account for people living with HIV and AIDS in the United States. So that's part of it, the stigma, the fear, and also part of our role as an organization with the Project of the Quad Cities is ensuring that everyone gets equal opportunities to education around HIV and AIDS. So that's part of it as well. If people don't have education that, yes, as a woman engaging in heterosexual relationships, that accounts for 86% of new cases and 86% of infection rates. So a lot of individuals don't know that they might be engaging in behaviors like unprotected sexual contact that can lead to HIV infection, even if they are a woman. So our job as an organization is really to dispel those myths, break those myths, and let everyone know that if they are engaging in certain behaviors, or it's been a while since they've had an STI screening panel or an HIV test, it's always time to get that done. If you're having new partners, engaging in behaviors, it's always worthwhile to get the education you need and get the care you need up front.
And when it comes to women, who is most affected by HIV and AIDS?
So like so many other diseases, there is a disproportionate burden often on people of color. And HIV and AIDS also, the numbers indicate that that's just the same, right? We know that 62% of new diagnoses in this country, in terms of women being diagnosed, 62% of those fall to Black and African American women. And we know that the health disparities in the Midwest, the region we're situated in as well, they're even greater. So not only do women of color have a disproportionate disease burden, they're more likely to be diagnosed or more likely to be living with it already. We just see that emphasized in making sure that people get access to quality care. Mm-hmm. So it's very similar across the board. If you're looking at heart disease, cancer, we're seeing that people of color are disproportionately impacted. And then another population to consider too, and that we are trying to work as the project of the Quad Cities to make sure we get folks through the door, get people the care they need, the testing they need. Transgender women are also disproportionately worlds above impacted by HIV and AIDS more than any population and subset population. So that's the one population of women that we're seeing a higher increase of diagnosis. Mm-hmm. So we're doing our best to have affirmative care on site for transgender women to come through, get tested, and be set up for success long term.
And Lauren, what can be done to prevent HIV transmission, and what services are available at the project to help women who are already living with the disease?
Yeah, great question. So prevention is key, right? And prevention is what allows us to say that we can put ourselves out of business, that we're truly doing the work of eliminating HIV and AIDS infection, especially in the Quad City too. So prevention looks like a few things. One, you can't know what you don't know. So we want everyone to get through the door, come to us to get tested. No matter what insurance coverage you provide, we will ensure that you can safely and freely get the access you need to HIV tests. We're able to do a rapid test on site as well. So it's also something that you don't have to live in limbo waiting for someone to call you on the phone. An unknown person, we will be there for you every step of the way relationally. Also, for people who are concerned that they might be at risk, we have two different medication options available on site for prevention. One is called PrEP, which is the pre-exposure prophylaxis. So what that means is a person is able to take a daily pill if they are worried that they're at risk for HIV to prevent it. And then similarly, we have a pill that's available. It's a post-exposure prophylaxis that within 72 hours of maybe unprotected sex or fear of exposure, you're able to take that and it drastically limits your risk of being infected with HIV. So we're able to do that on the prevention side, the testing side. And then we also care for people across their lifetime. We call it the Continuum of Care. That if you do get a positive status, if you're diagnosed by us or by a local affiliate provider, we will take care of you to the best of our ability every step of the way. So whether it looks like getting you medications, getting you connected with a doctor that you can trust and truly hears your concerns, getting you educated, getting your family educated, right? Unfortunately, the stigma that I mentioned before, it has people concerned that if I share a toilet with someone, if my family member is diagnosed, what does that mean when we hug? What does that mean to be interactive? So we also provide family-based education. And then we support with community resources and connection to social groups with other people, not just surviving with HIV, but thriving. So we're able to take care of people in that way as well.
Lauren, thank you so much for your time.
Thank you.
If you would like some more information, you can go to tpqc.org. We'll also have those details posted on ourquadcities.com.